Well, welcome everyone. My name is Christy Morgan, and I'm a physical therapist at UF Health in Gainesville, Florida. And this talk is going to be on proper footwear for the running athlete and evidence-based approach. Outline real quick, you've probably read this already. I'm going to do a quick about me, talk about running shoe categories and components, briefly go over the history of the running shoe, evidence on traditional minimalist and maximalist running shoes, a little bit about barefoot running, what we recommend here at our UF Health Running Medicine Clinic, orthotics in running shoes. I might breeze through that, and if people have more questions, you can certainly ask me after, which will be in our questions and discussion portion. So it's a lot of material, and I'll try to get through it all. And again, if you have any questions, please don't hesitate to ask. So real quick about me. I have been a physical therapist for 5.5 years. I went to undergraduate at Florida Southern College in Lakeland, Florida, where I actually swam. I was not a runner. And then I did physical therapy school at Florida Gulf Coast University in Fort Myers, Florida. I moved up to Gainesville in 2010 and did the sports residency here at UF and worked with multiple sports. I became a sports certified specialist in 2012, and I switched to managing the UF Health Running Medicine program in earlier this year. And the research I've currently been doing has been looking at the reliability and validity of using different iPad apps to measure gait kinematics on the treadmill. So there's a lot of different running shoe categories, and what we're going to be talking about today is road running shoes, which are designed for pavement or packed surfaces. But realize that there's also track running shoes, and there's lots of different types of track running shoes, and their stiffness and spikes vary based on the distance of the event. Also that there's trail running shoes that are more aggressive tread on the bottom of the shoe so that you can go over rocks and mud without any problems. And then that there's also cross-training shoes that can look very similar, but they are not running shoes. And I wanted to bring this up because I get a lot of runners who are running in cross-training shoes, and that's not what they're designed for. They're heavier and they're made more to support lateral movement. So if you have a runner in a cross-training shoe, get them out of that shoe. So in the road running category, we have lots of different types of shoes. We have cushion shoes. These are designed to increase shock absorption, and they have some medial support. And they also usually have a 10 to 12 millimeter drop. And so what that means is the thickness in the heel, from the heel to the ball of the foot, and the drop between those two. So again, a cushion shoe is usually going to be about 10 to 12 millimeters. A subcategory of that is maximal or ultra cushion shoes. These have just come about more recently. They have as much as 50% more cushioning for greater shock absorption. So common examples of cushion running shoes are the Mizuno Wave Rider, the Brooks Glycerin, the Nike Air Pegasus, the Asics Nimbus, and the Saucony ProGrid Triumph. Maximalist shoes are usually, the most popular is the Hoka, but then also the Ultra Paradigm 1.5. Then we have stability shoes. These are designed for mild to moderate overpronation, and they have a firm post reinforcing medially. Examples of stability shoes are the Asics Gel Kayano, the Nike Lunar Glide, the Brooks Adrenaline, and the Saucony